Cool, come on in.
Where do you get your scrubs from here?
Figs.
Do you?
Yeah.
Because I have to get scrubs for work. And
Yeah.
Can I put these on here?
Yeah, of course, yeah. You can hang your jacket up there as well.
I have to get scrubs for work, and no one at my clinic wears scrubs. But
Oh, really?
The university's asking me to wear them, and I'm like, oh God, I don't
Figs are nice. They like look really cool as well.
I don't want to look like a bit of an oddball.
Yeah.
In the clinic wearing scrubs, and just wears like smart casual wear.
Cool. So, how can we help you today then?
So I came in for my X-ray. How long? 2 weeks ago.
Yeah.
And my wisdom tooth is just broken through the gum, and then I've got 2 fillings that look like they need some attention.
How's that wisdom tooth doing now? Is it better?
So much better.
Yeah. Okay.
Like
good.
it's quite hard to clean and get back there because it's like right at the back. And I always kind of feel like there's maybe a little bit still left in there. But the other teeth, like they seem fine. I know they were deep fillings. So I knew that at some point they were going to have to.
Cool. How long ago were they done?
Maybe like 3 or 4 years ago.
Okay, fine.
Yeah.
Cool.
3 or 4 years.
Yeah, so Dr. Jane showed me the X-ray. So wisdom tooth is better, but there's a couple of fillings. On like the big X-ray, looked like there could be like little shadowing around them. But today we'll take like closer X-rays of those and see what they're like and what we need to do. Cool, perfect. Cool. Medically fit and well in general. You've done the forms. Anything you need to add or anything? No. Any particular questions you have about like teeth, hygiene, anything?
No, just probably, I know you're going to tell me I need to floss more and I need to do all of that.
Cool, fine. Right, so we'll do a full checkup. So you're going to check your jaw joints, teeth, gums. We'll do a mouth cancer screening that we do for everybody.
Okay.
Take some x-rays and take a digital scan, and then we can chat about everything.
Okay.
Cool. If at any point you think of anything you want to ask, just let me know.
Cool. Thank you.
Are you glad you made that choice?
I think so. I am finding the lectures really interesting.
Yeah.
So I do think like I'll enjoy the content, and that will just immediately help me through exams. Really, like as long as I enjoy it, then.
Fair enough. It's always easier when you enjoy it, right? Like.
Yeah, exactly.
Cool. Right. So tilt your head back for me. So I'm going to feel on the outside of your jaw. All right. So I'm just checking for like lymph nodes and saliva glands. Cool. And open as wide as you can, and close together. And really stretch open wide. Cool. And close together. Cool. Do you ever get like clicking, popping or anything in your jaw joints?
Yeah, I do.
Yeah?
And I get like an achy jaw sometimes.
Yeah. But it's like kind of manageable.
Manageable, and I definitely do clench, like if I'm stressed. Like I wake up and my jaw hurts because I've definitely been clenching at night.
Yeah.
So I notice that sometimes.
Cool. After the appointment, I'm going to send you an email with like links of like jaw pain and all that kind of stuff, which is some useful information as well.
I mean, it does help that Jake literally does like TMJ.
Exactly, yeah, he can help you out. Cool, right, open really wide. So checking all your soft tissues now, right? So your cheeks, tongue, the floor of your mouth, the roof of your mouth. So we do a cancer screening. So stick your tongue out for me, and into your right cheek, and into your left cheek, and curl your tongue up for me there. And relax. Cool. It's all looking fine. Do you smoke at all? Vape. Yeah. How often would you say?
I don't know how to measure like.
Yeah, because it's not like
vaping. Not like I would say every day, but I'm not like all the time like having to go out through work and stuff like that.
It's kind of like consistently like, but not excessively.
Yeah.
Yeah. Okay. Cool. So. Open really wide. I'm going to blow some air around all your teeth, okay? And then we'll go through a charting, and I'll explain everything at the end. So, Olga, we have upper right 8 missing, 7, 6, put a watch on the occlusal, 5, 4, 3, 2, 1, upper left 1, 2, 3, 4, 5, 6, 7, 8 partially erupted. Have you had some composite bonding done on your front teeth? Yeah. Across those top 4?
Uh-huh.
Yeah. Or just on that left
It might
hand?
have been 6 actually.
Okay. Yeah, it looks really good.
Oh, wow.
Cool.
It's quite old now. Like,
Yeah.
I got it done before I got my Invisalign done.
Yeah.
And then they were like, oh, we'll just keep it and then we'll just kind of like
Polish it.
down.
Yeah.
Polish it down.
No,
like
it's
that.
maintained really well. Cool. So lower left 8 partially erupted. 7, 6 fissure sealed. 5, 4, 3, 2, 1. Lower right 1, 2, 3, 4, 5 DO composite. 6 DO composite. 7 and 8's missing. Cool. Right. Get a little check of your gums now, okay? When was the last time you went to the hygienist?
About a month ago.
Okay. So PP, upper right's 1, upper central's 2, upper left 0, lower left 0, lower central's 2, and lower right's 0. Okay, cool. Right, bite down together for me. Okay. And open really wide. All right, sick. So, you take some x-rays now, okay? So a couple of x-rays of your back teeth, and then I'm gonna take a wide, oh no, we've got an OPG already, haven't we? Yeah, so just a couple of x-rays of your back teeth, yeah. Cool, so open really wide. Cool, and close together for me there. Brilliant. So just stay really still for a few seconds. Cool, open up.
I don't know why it's always really scary when I get an X-ray and you leave the room.
Yeah,
Where are we going?
we're like, we're sheltering ourselves. Open really wide. And close together. Yeah, it's like, it's safe for you to have every so often, but not for us to have all day, every day. Cool, open really wide, brilliant.
Got such fancy chairs in it.
They're quite comfortable, aren't they?
Yeah. They're so much better than one of the dentist.
Yeah. Cool. So I'm going to take a scan of your teeth, okay? So there's a little camera that goes around and creates like a digital model.
Oh yeah.
And then I can show you everything that I can see.
So weird.
Have you ever had a digital scan done? When you had your Invisalign,
I
yeah.
had when I had my
Yeah.
Invisalign, but I feel like that was ages ago.
Where did you get the Invisalign and the composite done?
So composite must have been like, let me think back, 2021 to, oh wait, yeah, no, yeah, 2021 and then Invisalign. Oh
Yeah.
no, that's a lie because I got the composite and then I got
Yeah.
the Invisalign after, so then that was only done like 2 years ago.
Was that the one near home at
Yeah.
that place? Yeah. Cool. And bite down together for me. Cool. And just keep together there. Great. I'm just going to take a couple of pictures of those bottom teeth. So open really wide. Can you open up those x-rays for me, Olga? Yeah. Do you get any pain or sensitivity from those bottom right-hand side teeth? Those two there?
No,
Okay.
not really. I do have like, I know that when I whiten my bottom teeth,
Yeah.
which I haven't done in ages,
Yeah.
my bottom teeth are just more sensitive than my top
Fine.
teeth, and I kind of like do them less because of that.
Yeah.
Because I'll get all the like horrible sensitivity.
Is that sensitivity at the front or at the back?
Usually at the front.
Front, yeah.
Yeah.
Fine, yeah. You can take a PA. I can take one more X-ray on that bottom right-hand side.
Okay.
Okay. What do you want to take? Cool. Open really wide. This one's a little bit more uncomfortable, okay? I'll dig in a little bit here. So just try and get that between your tongue and the teeth. Brilliant. And it's gently close together. Brilliant. Perfect. I stay still. Okay. Alright, so.
That looks so complicated.
Hi.
Those letters.
We had this cool AI program that then scans all these X-rays
Yeah.
and helps us like pick up stuff that we might not be able to see like normally. So this one, I don't know why it's come out like that. I don't need to retake it though because I can see enough.
So what are you looking for?
So I'll explain my thought process. So when I saw your last X-ray, which is here, increase the. Cool. So last X-ray, we can see your wisdom teeth poking through. This white stuff is a filling material, and obviously that's your tooth. That's what you can see, and then that's the root underneath there. These two fillings, you see there's a little dark space underneath. That kind of indicates either there's decay around the filling or the filling's not sealed properly. It can also mean that there's a liner, but I can see that both in both of those fillings there. So then these X-rays, that one didn't come out well. But from here, we're checking, most people get decay not on like the surface of their teeth, but where the teeth join together.
Yeah.
So we're checking all the teeth to make sure there's no decay in what we call the contact point around there.
Yeah.
And that's where flossing is really important. Flossing cleans
to get rid of
this
that bit.
area. So on the right hand side, this has come out really rubbish, but I can see that that filling looks like it's kind of chipping and it's not that smooth. When you're flossing, I know you say you need to floss more, but do you feel it like snagging in that area?
Yeah, sometimes I think it almost feels like it gets stuck and then I have to like...
Yeah, so that's not ideal because then food and stuff can get trapped there. And this filling, see that little shadowing there? And then it's really close to the nerve of your tooth.
Yeah.
So then I took this last X-ray because I wanted to see the roots of the teeth, to see the nerve and see if there's any signs of that nerve dying or any infections around there, which at the moment there isn't, which is a good thing. That AI software was saying that this was like an infection area, but I don't think it is. It's just how your bone is there. And that's just an opening of where one of your jaw nerves comes out. So those two fillings are the ones that I wanted to get you in to chat to you more about as well.
Yeah.
So if you look at this scan, so it's these two teeth here.
Yeah.
So that filling, you can see it's a bit old, picking up a bit of staining, and it's like a bit chipped and a bit rough on that surface.
Yeah.
So that's going to trap food, trap bacteria. So I'd recommend replacing that one for sure. Yeah, just a new filling would be fine. And then this filling here is the one with that kind of like shadowing underneath it.
There's a lot more shadowing
Yeah.
there, yeah.
So I'd suggest removing those fillings, making sure there's no decay or anything around there, and putting new fillings in there that are like smooth.
Okay.
Yeah. When you get a cavity that's quite big, your tooth can be quite liable to cracking. So you can consider an onlay. An onlay is kind of like a crown. So we take the height of the tooth down to stop it from breaking, but yours don't really need that, to be fair.
Okay, fine.
Initially, I was thinking, looking at your X-ray, that you might do, but I think just straight up new fillings will be okay.
Okay,
Yeah.
cool. Yeah?
Does that make sense?
Yeah, absolutely.
The rest of your teeth are all looking fine. You've got obviously your fixed retainers, they look good. Got some fissure sealants there. When I was charting your teeth, you heard me say like watch on a couple of them. So
Yeah.
on your upper molars, there's some staining
yeah.
on the surfaces. So There's a hard area to get to. That's basically a sign of like early decay that's in the enamel of your tooth, but it's not deep enough to need a filling yet.
Yeah.
So we can just keep an eye on it.
Okay,
just
fine.
be really
Just,
careful when
like,
you're cleaning.
hold
Yeah.
my toothbrush on it for a little.
This is like when you eat crisps and stuff, it sticks into like these little areas, and then
So gross.
and then that's your wisdom tooth peeking through there.
Oh.
So if the wisdom teeth carry on causing problems,
Yeah.
then we can arrange to have them taken out. So there's a little wisdom tooth on this bottom left-hand side.
I
as
didn't
well.
even know that one was there.
So you've got. Have you had a wisdom tooth removed?
No, but I had one of my adult teeth when I was like 13 taken out.
Fine.
So I think I think it's on my right side.
Yeah.
And I just had it. I don't know. I was young and it just got infected, and they were like, "Oh, let's just take it out."
Interesting. Okay. They probably took it out. Did you have braces? You must have done if you've got. Did you have braces when you were younger before you had Invisalign? Fine. So I think that's probably your wisdom tooth that's just come into the right position.
Yeah.
And then on the other three corners of your mouth, you've got wisdom teeth all sticking out in different directions. So they can cause problems. They can cause like food trapping and decay in the tooth in front of it. So just check that bottom left. So yeah, I'll keep an eye on those. Come back and see me for a checkup in a year's time after we do these fillings.
Okay.
We'll keep an eye on those, and if we need to remove them, then
I almost felt like when that one came through, or like it just felt like there was loads of pressure on the side of my mouth all of a sudden, and then it was like aching. And I didn't really know what it was, and then I actually like looked in the mirror, and then I got Jake to take a photo of it.
Yeah.
And I was a bit like, oh god, that doesn't look right.
Yeah. Actually, you know what? I'm going to take a PA off that lower left 7. Let me take one more X-ray. I just want to have a look at that little contact point. So sit back again there. Does that all make sense?
Yeah.
Was that all useful? Yeah.
Yeah. I kind of knew that those fillings would probably need to be done at some point because I knew they were deep fillings.
Yeah.
And then since those, I've had Invisalign and composite, and it's been years, so I'm like, fine.
Get them replaced, yeah.
Yeah, I'd rather do that than have to get a root canal later down the line or something horrible.
Yeah, to be honest, those two teeth, especially that premolar one, is at a higher risk of needing a root canal at some point.
At some point, yeah.
Once decay's already that deep, then you're kind of just waiting for it to happen.
Yeah, I'll cross that bridge when it comes to it.
So, open it as wide as you can. This one similar, it's going to be a little bit further back, so a bit harder. Cool. And close together for me. Brilliant. Yes, yeah, just want to make sure that there's not already some decay in that molar in front of the wisdom tooth. You can see, so a normal tooth pulp has these 2 horns. That's where the nerve sits. That horn is there, it's just completely receded because the cavity's gone close.
Yeah.
So it kind of shrinks back. But there's no signs of any infection or anything around the edges.
What's the process of getting the old filling out? Just like pry it out?
Yeah, just drill it out. We just cut it. So we numb the teeth and we literally just cut the filling out. Try and touch as little of the tooth as possible, and then we remove any decay around in the tooth if we need to. That tooth's completely fine. Yeah.
Okay.
So wisdom teeth we'll just keep an eye on. Try and get right to the back, try and floss around them, and then we'll just take x-rays and monitor it. Cool. Right. Anything else?
No, I think that's it.
Yeah, cool.
Yeah.
Right, come with me to reception. I'll print off a treatment plan for you, and then they'll get all that sorted out and booked in.